welcome to this episode of Ask the Doc. I am your hostess, Jennifer Filzen, and I'm in studio today with Dr. Ilya Skolnikoff of Triad of Health Family Healing Center. Welcome, Doctor.
Hey, thank you for having me, Jennifer. I appreciate your getting me in last minute here.
Oh, it's fantastic having you. And how was your Labor Day?
Labor Day is good. I'm excited to answer any questions since this is the Ask the Doc, and I am the doc to ask.
Yes, of course. So tell us a bit about your practice in San Rafael, California.
We get sick people well. A lot of people are dealing with autoimmune disease, thyroid disease, mood disorders, and hormone imbalances, and they don't know who to go to. They don't know who to turn to. They don't know what to do. So I personally had a lot of challenges with acne and all kinds of different thyroid type conditions. So fortunately, I was able to find somebody who was able to help me. And when they helped me, I decided to dedicate myself to learning those same types of therapies. And now about 20 some odd years later, here we are, and we're doing this podcast to help get the word out into the community that you don't have to suffer with autoimmune disease needlessly. It's actually a lifestyle disease, meaning that we can change our lifestyle and we can get rid of the disease and its cause. So a lot of people are just not sure how to do that. And they're being given a misinformation campaign rather than information that's helpful. So I wrote the book about how to get better from autoimmune disease, thyroid disease, mood disorders, and other inflammatory conditions to help set the record straight.
I'm loving this.
Method.
Okay. First off, I am just totally loving the fact that you have your own personal challenges, right? And it's those challenges in life that help us create the path that we are going down. And here you are making others better because you have suffered through those things yourself. So if you don't mind telling us, tell us who the people are that you're serving. Like, how do they discover you? How do they even know? Because so often we are just going through life assuming that what we're feeling is normal. How do they finally understand that this is something that they can heal from and that there's relief? How do you find these folks and who are you serving?
I should be asking myself that same question. Okay. That's a really good question. So I don't really know. I think I'll meet people, and people are sick and tired of feeling sick and tired. There's a friend of mine. He's really, really well known to help promote doctors and other professionals like attorneys and financial advisors with their practices and with their careers. And this particular person, he recently had all kinds of difficulties with his vision. Before he had trouble with his vision, he had been using pot, smoking pot regularly for many, many years. And also he was an alcoholic at a certain point. So he's been free from alcohol and free from pot for about, I don't know, maybe 15 years or something like that. But he didn't know what to do. So we thought, maybe he would just go and get his lenses replaced, because that's what the typical thinking is. However,
right.
I just had a chance to go through his labs before he made that decision. And what I found on his labs is that even though he'd been misdiagnosed and the medical doctors who'd gone through his labs said, oh, everything seems pretty okay, you're just a little bit tired, maybe get a little rest. He has thyroid disease. He has the beginning of a heart condition. He has pretty much adrenal failure. And all that pot and alcohol caused him to be really toxic. So his kidneys are toxic. His liver is toxic. He gets angry all the time. And the reason his vision doesn't work is he has this autoimmune type of condition that nobody diagnosed. Nobody. I mean, I'm the only person, pretty much. I'm the only one with the Skolnikoff Method, it seems. So I figured out that he has a really severe gut disorder called ileocecal valve syndrome, which is an imbalance between the bladder and kidney meridians. The kidneys are related to the eyes. His eyes and kidneys are related to fear, which is the emotion of the kidneys. When he's talking about getting his lenses replaced, he's saying he's really scared about it and he has a lot of fear.
Yeah.
So how do I find people like that? No, they find me. I don't find them. So people are sick and tired of feeling sick and tired. We run ads on Facebook. People who have their Hashimoto's thyroiditis gone in 6 or 8 visits after just a few months when nobody else was able to help them, they tell their friends and family. Arlene Cotto, who had Graves' disease and was either freezing cold or burning hot all the time and couldn't go out in public and couldn't keep a job and was about to go on disability. When we got rid of her Graves' disease entirely, of course, she's telling her friends and family. I have people calling all the time who are friends with Arlene Cotto or her boyfriend, Simon, who's also gotten a lot of help with his health. So that's how people find us. They're tired of the medical establishment that's been misleading them, lying to them, and basically presenting all kinds of misinformation campaigns that are more like manipulative sort of mind control propaganda rather than anything that really has to do with health or science or logic and reasoning or intelligence. I mean, It's pretty profound what people are calling science and health these days. It's more like, the dark ages when we thought, things that were happening were not really happening, like heal people with leeches and use maggots to get rid of gangrene. I mean, that's right. Interesting, but it's not really what we should be doing in healthcare. We're past that now. It's, we have science that's more valuable than that. Yeah.
Well, this is so fascinating. And I love that you have shared with us some success stories. Okay, so now you have developed the Skolnikoff Method and you've written a book. Tell us about your journey with that. How did you discover this methodology, and how did you in your book, are you sharing some of your success stories, and how do people get your book? Like, walk us through that.
In all honesty, I did not develop the techniques in the Skolnikoff Method, but yes, I developed the concept of the Skolnikoff Method for average people to go from the symptoms that they're having, the aggravation, the irritation, the pain, the annoyances, the confusion, the not knowing where to go or who to get help with, or who to get help from, I should say, not with, and help with and from. People can just go to Skolnikoff.com to get my book. The Skolnikoff Method is 2 books in one. So you buy one book and get one free. And it's an interactive book. So there's all kinds of videos and audios attached to it. Yeah, Skolnikoff is just like it is on the page here. It's spelled the same way, Skolnikoff. So it's somewhat straightforward. I don't think that people who have an autoimmune disease that they've been to the doctor for, that they haven't gotten results with, are not confused and not frustrated. They are, So people who are frustrated, who have a chronic disease like diabetes or heart disease or cancer or, Hashimoto's or Graves' disease or whatever, most of these diseases, they're treatable diseases. People can get better. The disease is real. People feel bad. They know it's real. They know they're not faking things. And so can be their healing. Their healing can be just as real as their disease can be. But if they don't know where to go and they don't know who to turn to, then maybe they won't ever get the results that they want. So they need to do something different if they're not happy with the results they've been getting, right? That's kind of how this works.
Right. Well, I tell you what, Doctor, you are fascinating. And I'm so glad that you are healing people by reducing their frustrations, re-diagnosing, finding out the true sources, and helping them get better. Oh my gosh, this is amazing. Everybody, I hope you enjoyed today's episode with Dr. Ilya Skolnikoff. He is phenomenal. And if you want to find out more about him and his book and his business, please check out the work that he's doing. You can go to Buzz TV at iwantabuzz.com and find out more. But doctor, thank you so very much. We are so happy we had you on Ask the Doc today.
Thank you very much for having me. I really appreciate it. It's always good to get the word out. Thank you. You're a great host, very personable and likable.
Thank you. Right back at you. All right, everybody. Thank you. Bye.